Good day, ma'am, and to each and everyone. So my name is Eliza Cristofa Ferris from BSN 1A of Iloilo Doctors College. And for today, I'm going to perform a turn demonstration in regards of assessing the mouth and throat. So prior to performing this procedure, we need to, of course, perform hand washing or hand hygiene and done our PPE if there's a necessary. So I have here an alcohol that serves as my sanitizer. And it is also important for us to prepare all the equipment needed for the assessment. And the next thing we're going to do is proceed with the assessment proper. Hi there, ma'am. Good day. How are you doing?
I'm good.
Okay, that's great to hear. So by the way, my name is Eliza Cristofa Ferris and I'm your student nurse for today. And please confirm to me your name as well as your date of birth, please.
I am Ada Kalim Coferas. I was born December 16, 1998.
Okay, thank you for that. So I think we're good in here. So the first thing that we're going to do is to identify our patient. So this is to ensure that we have the right patient in front of us. And it is also important for us to establish rapport and introduce ourselves towards our patient. So if there's any curtains or doors within the area, we need to close them in order for us to provide privacy to our patient. So the next thing that we're going to do is to explain the procedure to our patient. Alright, so Ma'am Ada, so I'm here to perform the assessment of your mouth as well as your throat. So why do you have to do this? So this is to ensure that everything is normal. And if there is abnormalities in your mouth and in your throat, it's just like if there's any discoloration, swelling, lesion, if there's any abnormalities in the size of your mouth and throat, so we need to take note of them in order for us to prevent further complications. So do you have any questions with that or any clarifications?
No, ma'am.
Alright, so if you do have any questions all throughout the assessment, you do have the freedom to do so, okay?
Okay.
Alright, thank you. So the next thing that we're going to do is to make sure that our patient is having a comfortable position. Right, so are you in your comfortable position right now, ma'am?
Yes, ma'am.
Okay. So the next thing we're going to do is to proceed with the first procedure that we're going to do, which is what we call inspection. But before that, we're going to don our gloves first. We are going to don our gloves, so this is to ensure that we have a clean hands because we are going to expose the mouth of our patient. Alright. So the first thing that we're going to inspect is for the lips of our patient. So here we are looking for the color, symmetry, consistency, as well as the contour and the lesions located on the lips of our patient. Okay, so Ma'am Ada, I'm going to inspect here. Okay, so as I'm inspecting my patient's lips, she has a pink color lips and has a moisture and smooth texture, which is good. And there is no occurrence also of lesion and lip cracks. So the abnormal findings for the lips, if it has a discoloration just like the lower, which indicates anemia, bluish or indicates cyanotic or result from cold or hypoxia. And if there's any swelling, it may indicate edema or allergic reaction. So we need to take note of them. So the next thing that we're going to inspect is for the mucosa and gums of our patient. Here we are looking for the color, integrity, adherence, as well as lesions in the mucosa and gums of our patient. So first of all, we're going to check here for the mucosa. So using the pen light and the tongue depressor, we are going to retract the lips and cheek of our patient. Okay, so can you please open your mouth now? Right? So as I am inspecting the mucosa of my patient, she has a pink color and it has a smooth and moisture texture. So the abnormal indication for the mucosa, if it has a whitish curd-like patches that scrape off our mucosa, and bleed easily, it may indicate Candida albicans infection. So we need to take note of that abnormality. So next is we're going to check for the gums. So, ma'am, can you please open your mouth for me? Right, so as I'm inspecting the gums of my patient, she had the color and consistency of tissue along the cheeks and gums are even, which is good. And her gums also has a pink color, moist and firm with tight margins on the tooth, which is also a good and normal finding. And there are no also lesions or masses. So there is also abnormalities that can be seen on the gums of our patient, which includes the receding gums. And next is we have the red swollen of gums that bleed easily, which may indicate a gingivitis curvae, and the bluish or bluish black or gray whitish color along the gum line, which can be seen in lead poisoning, and the receding gums with loosening of teeth, which indicates periodontitis. And next is we have the large reddened gum. It may indicate hyperplasia. So we need to take note of all those abnormalities. So the next thing that we're going to check is for the salivary glands. So first we are going to check here for the Stenson gland. And here, okay, now go open your mouth again. Check for your salivary gland. Right? Okay, so as I'm inspecting them, it has visible flow of saliva, which is good, and it has also a pinkish color, and which is good as well. And the next thing we're going to inspect here is for the Wharton's duct. Open your mouth. Great. Okay, thank you. So here in the Wharton's duct, it has also a visible salivary flow, and it also has a no swelling and no redness as well, which is a good finding. And if the abnormal finding for the Wharton's gland is if it has an ulcer or if it has a lesion on it. So we need to take note of that abnormality. So the next thing that we're going to inspect is for the teeth of our patient. So here we are looking for the number. We are looking for the condition or oral hygiene as well as the dental works of our patient. Okay, so Ma'am Ada, can you please show me your teeth first? Okay, so here I'm looking for if there's any abnormalities on the size of the teeth, and as I'm assessing the teeth of my patient, okay, open your mouth please. Okay, so there are no missing tooth, there are no decays, as well as no cavities, which is a normal finding. So the next thing that we're going to inspect is for the labial and lingual frenulum. So here it is located at the upper part of our lip, and then as we are going to ask our patient to raise her tongue on the upper part. Okay. So now I'm going to check here first your upper part, okay? And then the other one, please. Stick your tongue up. Alright, so as I am inspecting the labial and lingual frenulum, they're all located in the midline, which is good. So if there is any asymmetric movement on the frenulum of our patient, it may indicate a stroke. So the next thing that we're going to inspect is for the hard and soft palate. So the hard palate is located anteriorly and the soft palate is located posteriorly. So here we are going to check for the integrity as well as the adherence of the palate. Okay, I'm going to check here your palate again. Up. So here the hard palate and the soft palate. Okay, thank you for that, Ma'am Ada. So as I am assessing my patient's hard palate, it has a pale white color, which indicates that is a normal finding. And as I am assessing also the soft palate of my patient, it has a spongy and smooth texture, which is good, and it has also a pinkish color, and the palatine tissues are in intact position. So Right? So there are no abnormalities that occur in the hard and soft palate of my patient. So the next thing that I'm going to inspect is for the breath and breath sounds of my patient. Okay, so Ma'am Ada, I would like to ask you to inhale and exhale using your mouth, okay? Alright. Okay, so as I'm assessing my patient's breathing as well as the breath sounds, there are no abnormalities. So if there is any abnormal sounds that can be heard, we are going to take note of them. So the next thing that we're going to check is for the uvula as well as the tonsils. So the uvula is located at the center of our mouth, okay? So ma'am, I would like you to please open your mouth for me and stick out your tongue, please. Okay? Right. So as I'm assessing my patient's uvula, it can be, the uvula is fleshy and it has a solid structure, which is good, and it hangs freely in the midline part of the mouth of our patient, which is good. So if there is any asymmetric movement on the uvula of our patient after we check it, there is an indication of stroke. So the next thing we're going to check here is for the tonsils of our patient. So here we're going to use the tongue depressor. Can you please stick out your tongue and then say ah? Alright. So here we can see the tonsils might be absent or present. So in the case of my patient, I can see the tonsils on her mouth, and it has no redness, or it has no abnormalities in the size of the tonsils, which is good. So the abnormal findings for the tonsils of our patient, if there's any redness, if there's any swelling, if there's any exudate, so we need to take note of them because it can indicate tonsillitis. So the next thing that we're going to check is for the posterior pharyngeal wall, or the pharynx of our patient, or the throat. So ma'am, I would like to ask you to please open your mouth and tongue out and say ah. Alright? Okay. So as I'm inspecting the pharynx of my patient, it has a pink color, as well as there are no lesions that occur, which is good. And if there is any abnormalities that occur in the throat of our patient, so we need to take note of them. And we are done now on the inspection procedure. So next is we are going to proceed with the next procedure, which is what we call palpation. So what are we going to palpate first? So we are going to palpate first the lips of our patient. And after that, we are going to palpate also the gums of our patient. So, going to palpate here, ma'am, your lips. Touch your lips. Do you feel any pain?
No, ma'am.
Alright. Can you please open your mouth for me? Okay, I'm going to touch your gums. Do you feel any pain or hurt?
No, ma'am.
Alright. So the next thing that we're going to palpate is for the salivary gland of our patient. So, I'm going to touch here. Do you feel any pain?
No.
How about here? Do you
No,
feel? Okay. So, there are no abnormalities that occur since my patient doesn't feel any pain or any hurt as I palpate the salivary gland. So, the next thing we're going to palpate is the tongue. And afterwards, we're going to palpate the hard and soft palate. Okay. Can you please stick out your tongue for me? Okay. Do you feel any hurt as I palpate them? Alright. Okay. So far, everything is good on the tongue of our patient. How about here in your hard palate? Do you feel any pain? Okay. In your soft palate? Do you feel any pain? Alright. Okay. So the next thing that we're going to do is to dispose the glove, since we use it to palpate the mouth of our patient. Alright, so the next thing that we're going to do is to check for the cranial nerves. So we have different testing for the cranial nerves here in the mouth and the throat of our patient. So first we are going to test for the cranial nerve number 5, which is what we call trigeminal nerve. So here we are going to check for the ability to chew. Okay, so as I'm going to apply pressure on the chin of my patient, and then she is going to try to open or close her mouth. Okay, so ma'am, I'm going to ask you to please open your mouth, please. Okay, and then close. Do the same process, please. All right. Okay. So as I am checking for the ability on or the strength of on how my patient chew, there are no abnormalities so far, which is good. So the next thing that we're going to test is for the cranial nerve number 7 and cranial nerve number 9, which is what we call the facial and glossopharyngeal nerves. So here we are going to test for the taste. So I have here prepared a tablespoon of sugar and salt. So the patient will indicate and tell me if she can taste the sweetness and saltness of these objects. Can you please taste this one? So what is your taste, ma'am? Did you taste sweetness or any other?
It tasted sweet.
Okay. So how about this one, ma'am? This right?
It tastes salt.
Okay, so far my patient's taste doesn't have any abnormalities, which is good. So the next thing that we're going to test here is for the cranial nerve number 9 and cranial nerve number 10, which is what we call the glossopharyngeal as well as the vagus nerve of our patient. So here, first we are going to check here for the speech of our patient. Okay, so Ma'am Ada, can you please tell me what I'm holding here?
You were holding a black ball pen.
Okay, so far the speech of my patient doesn't have any abnormalities, which is good. And next is we are going to check here if my patient can swallow or if there's any pain as she swallows the water. Okay, so you're going to tell me if you feel any hurt as you swallow the water.
It's all good.
Okay, so far there are no abnormalities, which is good. So the next thing that we're going to check here is for the gag reflex. And this we are going to use the tongue compressor and we are going to touch the soft palate so that my patient can have the gag reflex. Okay, so as we can see here, the patient showed a gag reflex, and which is good. So if there is no occurrence of gag reflex, we need to take note of them because it indicates abnormalities. So the next thing that we're going to inspect is for the hypoglossal nerve, or which we call the cranial nerve number 12. So here we are going to check the strength of the tongue. So I'm going to ask my patient to move her tongue on the side and to the other side as well, as I'm going to apply pressure and test for the strength of the tongue of my patient. Okay, ma'am, can you please put your tongue here? All right. On the other side, can you please put your tongue? All right, other one. All right. So it seems that there are no abnormalities in terms of testing for the tongue strength of my patient. And after that, we are going to provide a patient care, and after that, we are going also to wash our hand and document all the findings. Okay, ma'am, so we are good in here. So thank you for your participation.
Thank you, ma'am.
that's all, and thank you.